it has a significantly lower risk of injury to the nerve. Probably 10 to 15% of patients who have a standard 4-hour facelift done, where you're dissecting off the mass tissue, the gristle tissue, and get down to the level of the nerves with a very gentle and spreading technique. In other words, spread, don't cut. And spreading the tissue, will end up with a temporary nerve got stretched nerve injury. I have never had a permanent nerve injury from a facelift. But by doing this technique and staying outside of that gristle tissue and really sewing the gristle tissue, you're so far away from the nerve that I have not even had a temporary nerve injury with this procedure. Patients have a drain that exits just below the lower part of the incision that stays in overnight. The complication of this procedure in my hands has been temporary 1 or 2 milliliter, that's 1/5 of a teaspoon of blood that'll sit and pool and take 1 or 2 weeks for that to resolve, or sometimes we'll push it out when we take the drain out. I've had 0 nerve injuries. The scarring is terrific because it's hidden right in the hairline with a zigzag scar, hidden right in a fold line here behind the tragus, and stops here. This is a procedure that in Ghent, Belgium, they do in an office situation under a local anesthetic. But in Ghent, Belgium, they can give people drugs through the vein and through the in the muscle that we can't use in the United States. And so in the United States, in most people, what I do is I take patients downstairs to Theda Clark Outpatient Surgery Center and give them an IV. And through the IV, I direct the nurse to give them sedation medicine so they're under twilight. And under twilight anesthesia, I'm able to inject them with local, not much more than an ounce of total local anesthesia is used for this procedure. Do the liposuction. People tolerate this very well. They're not nauseated because they don't have an anesthetic agent. They're not nauseated because typically they don't need a significant amount of narcotic. And patients get up when this operation is done, and within half an hour of the completion of this operation, with foam rubber padding where the liposuction is done and a head wrap, they go out of this operation and walk out the door. We will typically see the patient the day after to remove those drains and to check and make sure everything has done well. They'll wear a chin strap or a dressing, usually for 3 or 4 days, so they really need to hibernate for that period of time. We do other procedures at the same time, including especially pro-fractional peeling. A facelift, when done in any of the techniques, does not deal with anything on the inside of these folds. People sometimes want to have the wrinkles dealt with a laser, or have fat injections done in their nasolabial fold, or have some of the skin that gets peeled off of here replaced into their lips to fill their lips. We'll sometimes do their eyelids, we'll sometimes do other laser peels. So depending on the amount of procedure they've had, how close we have to follow them can change. Typically though, this is 1 week out of the limelight. We've had several of our patients go out to lunch the week after this procedure with their friends or even family members and not have them know that they had surgery other than that they look different.